This, of course, is the million-dollar question. Everyone acknowledges there's a problem, but who's going to bell the cat? Not me. No one really wants to do this. So I think this is a very courageous step the department has taken. So full marks. And I'm actually hoping that this is just the starting point. We need to continue having these conversations on an ongoing basis. And ideally, we need to invite patients in these conferences so that we can look at world from their perspective. We know what they're thinking about, and they can understand what our perspective is too. It's not fair to label all doctors as being corrupt, and that's actually what started to happen. So let's first look at the rationalizations and justification. We all know doctors are smart, and no one wants to acknowledge the fact that they're doing something wrong. So the first line is, the family physician serves a very important role in the healthcare system. He's the primary care doctor. So when he refers the patient to a specialist, he's acting as a bridge between the patient, the family, and the specialist. And obviously, he needs to be reimbursed for his services. And it's not fair that a surgeon gets paid 1 lakh rupees for a 30-minute operation, whereas the GP gets paid only 100 rupees for that same 30 minutes. So this is one way of normalizing that relationship. So they've earned the referral fee because that's what the work they're doing. The second common justification is, why are you targeting doctors? We're not gods. We don't pretend to be. We're just human beings. Every other profession does it, whether it's lawyers, architects, you name it. So why should we be held to a different standard? The third, very difficult to argue with, is our seniors do it. And if our seniors do it, they are our role models. What's wrong if we do it? Because the fact that they need to do it means obviously we need to. And today, of course, now that medical colleges have become privatized and they're owned by politicians and you've paid so many lakhs of rupees, you need to pay off the debt. So people are now looking for a return on investment on their education, which is why this is becoming worse.